We're going to tackle a really tough topic today, but honestly, it's one of the most important things any of us can ever learn. We're talking about how to protect infants from a tragedy that is completely preventable. The information we're about to go through literally saves lives. So let's dive right in. Take a look at this number, 5 seconds. You know, it's a shockingly small amount of time. Think about it. What can you do in 5 seconds? You can tie a shoe, take a deep breath, but those same 5 seconds can also change a child's life forever.
Because 5 seconds of violent shaking, that's it. That's all it takes to cause permanent, irreversible brain damage to a baby.
The official name for this is abusive head trauma, or AHT. It's a severe brain injury, and tragically, it is the leading cause of death and long-term disability from child abuse. So what is it that makes an infant so incredibly vulnerable to this? Well, to really get it, we have to look at the unique physical reasons that put babies at such a high risk. It all comes down to their anatomy.
This chart kind of breaks down the tragic physics of what happens. See, a baby's head is much bigger and heavier compared to the rest of their body, and their neck muscles are still really weak. So when a baby is shaken, their soft, still developing brain literally slams back and forth inside the skull. This motion causes bruising, swelling, bleeding, and it can tear the delicate nerve fibers that make everything work.
And the results of that damage? They're just catastrophic, and they last a lifetime. We're talking about things like blindness or hearing loss, seizures, cerebral palsy, really severe learning disabilities, and in the worst cases, death. It's absolutely devastating.
So I need to be crystal clear about this, and it can't be said enough. There is absolutely no safe amount of shaking. Not for a single second. Not gently, not in frustration, not even in play. Never. Ever.
Okay, so knowing the danger is step 1. But step 2 is just as critical, and that's being able to recognize the warning signs, the signs that say you need to get help right now.
If a baby has a head injury like this, they might show some of these symptoms. They could be extremely fussy, or the opposite, unusually sleepy and hard to wake up. Other big red flags are things like forceful vomiting, seizures, or having trouble breathing. You might even see physical signs like a bulging soft spot on their head, pupils that are different sizes, or skin that looks pale or even bluish. These are all signs of a major medical emergency.
And if you see any of those signs, there is only one thing to do. It's not a wait-and-see situation. You don't second-guess it. You call 911 immediately.
So we know what AHT is, why it's so incredibly dangerous, and what the emergency signs are. But what on earth would lead a person to do something so awful? What is the #1 trigger for this?
And the answer, almost every single time, is a caregiver reaching a breaking point, feeling overwhelming frustration because a baby is crying and just won't stop. Let's be clear, feeling frustrated is normal. It's human. The tragedy happens when that frustration turns into a dangerous action.
So, to stop this from happening, we need to understand that trigger. And thankfully, there's a really helpful way to frame it. It helps caregivers understand that this period of intense crying is actually a normal, even though it's incredibly hard, part of a baby's development. It's called the period of purple crying. Now, purple is just an acronym to help you remember what's going on. The P stands for peak of crying. It usually gets worse until about 2 months old, and then it gets better. U is for unexpected. It can start and stop for no reason at all. R is for resist soothing, and this is a big one. Sometimes no matter what you do, the baby keeps crying. The second P is for a pain-like face. They look like they're in pain even when they're perfectly fine. L is for long-lasting. Crying can go on for 5 hours a day or even more. And E is for evening. It's often way worse in the late afternoon or evening. Just knowing this is a normal phase can make all the difference in the world. Okay, so you get it. You know this crying is normal, but what happens when you're in that moment? The crying has been going on for hours, and you can feel yourself getting angry or overwhelmed. That feeling is okay. The question is, what do you do now? This brings us to the most powerful and practical part of our explainer today. This is your safe action plan, what to do the second you feel that frustration taking over. It's a simple 3-step plan to remember. Number 1, place the baby gently in a safe place, like their crib on their back. They are safe there. Number 2, walk away, just for a few moments. Step into another room. Number 3, take a few slow, deep breaths. Give yourself a minute to calm down and reset. The baby is safe, and you need to get to a calm place too.
Once you feel a little calmer, then you can go back and try some other things. Run through the basics. Are they hungry? Does their diaper need to be changed? Maybe try some gentle rocking, or just walking to a different part of the house. Soft music or white noise can help. And please remember this. It is always, always okay to ask for help. Call a friend, a family member, a colleague, anyone.
I mean, that's really what it all boils down to. Do ask for help when you need it, and do offer to step in if you see a colleague getting stressed out. But you never, ever shake, jolt, or toss an infant, and you never cover their mouth or face to try and stop the crying.
You know, this is a shared responsibility. Preventing this tragedy is all about teamwork. If you see another parent or caregiver who's starting to look frustrated, the kindest, most helpful thing you can do is just offer to take the baby for a few minutes. That simple act could be a total lifeline.
Look, the reality of abusive head trauma is just heartbreaking. It's devastating. But here is the single most important thing to take away from all this. It is 100% preventable. Having the right knowledge and having a safe plan, that's what stops this from ever happening. What we've just gone over, it's so much more than just information. It is a tool that protects the most vulnerable little people in our lives. This knowledge literally saves lives. So the only question left is, who are you going to share it with?